got the doctor in the place. Hear the rhythm when the doctor come through. Carry and roots and he know what to do. Professor the building educator true. Black health is a mission and he coming for you. Dr. Johnson, raise it up, raise it up. Knowledge in his hands and he ain't give it up. The doctor is here, let the rhythm come through. The people are calling and he coming for you. From the islands to the class to the ladies way. Black health in his blood like Carrigan soul. Oh, black health in his blood like Carrigan soul. The doctor in the building and he coming in. Oh, Dr. Johnson, rhythm in the room. Black excellence living on the culture in bloom. Raise it up, raise it up, raise it up, raise it up. The people alive and the doctor right. Go, go, go. Research on the table, knowledge on the floor. Breaking down the system and the healthcare door. Remember the spirit, he covers all three, the antidote to everything they don't want us to be. Dr. Johnson, rhythm in the room. Black excellence living on the culture in bloom. Raise it up, raise it up. The culture alive and the doctor right. Raise it up, raise it up. The culture alive and the doctor right. Go, go, go.
Welcome, LIC. Welcome on in. We are grabbing our daily heartbeat. We are liking the live. That's my song from Her Divine Alchemy. You hear the variety. Let me put it to my story. Good evening, ma'am. How are you doing? Hold on, did it post to the story? Let's play my song again, because I don't know what y'all got going on. I have a variety of songs I could play. Let me pull all my songs up.
Yeah.
We are grabbing our daily heartbeat and reposting the live.
Get it in, 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 get it in. Get it in, get it in, get it in, yeah. Get it in, 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 get it in. From Island roots to Miami sun, scholars mind the work well done. Healthcare vision steady on, teaching others how to stand. Cultural bridges bold and wide, seeing people through deeper eyes. Not just degrees framed on a wall, but lifting futures one and all. He studies systems, breaks them down, builds new leaders from the ground, shows professionals where they fit, hands them lights as walking in. Lean in, lean in, lean in.
Everybody, we are just joining on in. Damn, I'm screaming. We are grabbing our daily heartbeat. We are liking the live. Eve Rose, I see you. Welcome on in. L, you hear the song. L, which one do you like better? Do you like Lean In or do you like Office Hours better? Drop it down in the chat. Eve Rose, as we are waiting till we get to 6K likes, drop in the chat. How are you doing? What's going on? Any updates? What you want to share with Dr. Johnson? Same thing with you, El Meek. Future. Doctor, what you got going on? Anything you want to share with Dr. J as we're waiting to get to 6K likes? What you got going on? Oh, you like Office Hours better? Aaron, I see you. Welcome on in. You joined just in time. Perfect. I see you. There we go. There we go.
There's space for you. Students, teachers, dreamers too, from class.
Aaron, I'm checking in with you as we're waiting to get to 6K likes. What's going on with you? How have you been? Is your class over? The one that you had at 7, how is that going? Because the semester, well, every school is different. But everybody joining on in, we are grabbing our daily heartbeat. We are liking the live. And once we get to 6K likes, we're going to go ahead and get started on our trending topic in healthcare. Then we're going to get into our guest. And then we are going to wrap it up with some professor tips. You've been good wrapping it up. Okay, Eve Rose, how many classes are you taking this semester? Same thing with you, Aaron. How many classes are you taking this semester? I like Office Hours better. Let me cut this up. I do like Office Hours better. Okay, you taking 3 classes. Damn, you taking 5 classes. You guys can do it. Eve Rose, you're taking 3 classes. Okay. Are you also remind me, I think you're also working. How is that going for you? Because I had a conversation the other day with a student and they were they were apprehensive about taking more than 2 classes with their full-time job, but I told them that they can do it. Lady Red, I see you. Welcome on in. We are grabbing our daily heart, me liking the live, reposting, and getting to 6K likes. Once we hit 6K likes, we're gonna go ahead and get started on our trending topic in healthcare. Same thing with you, Aaron. You're taking 5 classes. Kudos to you. How do you feel? Are you able to manage school and work and just work-life balance overall? Thank you so much for grabbing your daily heart, me Lady Red. I see you. Something you could use. I see you. Welcome on in. Okay, Evros, you got hired as a CNA. Okay, can I have whoever's in this chat? Can I have a couple round of applause for my friend in the chat, Evros, please? She just got hired as a CNA and she's currently in school working on her bachelor's degree. That's what I'm talking about.
Step in your field, knowledge is power when it's revealed. You don't just teach it.
Hold on, let me scroll in the chat. I see you guys sharing out the live. I appreciate you. Thank you so much. Something you could use. I see you. Thank you. Okay, Aaron, you said it's not gonna lie. It's not that easy, but it's manageable. Yeah, you gotta do it. You gotta do it. You gotta knock these classes out and do it. Okay. When you take more than 4 classes and you juggle a full-time job, you really have to practice, effective time management skills. Something you could use. I see you lighting up the gallery. I appreciate you. Let me see what Lady Red said. Lady Red said, worked as a CNA for 19 years and completing my MSW, your master's degree in social work in 7 weeks. Eve Rose, I hope you're in here connecting with Lady Red. You see what Lady Red is going the route of social work. Eve Rose wants to go the route of healthcare administration, if I'm not mistaken. But everybody, as we are joining on in, we are grabbing our daily heart me. We are liking the live. Once we hit 6K likes, we're gonna go ahead and get started. We just got up on Dr. Henry. I see you. Welcome on in. I'm streaming. Hold on. I see you. Thank you so much for sharing out the live, everybody. But yes, when you take more than 3 to 4 classes, when you get into that 4 to 5 classes, you really have to practice proper time management skills. For those of you who just joined on in, I was just talking to Eve Rose and Aaron in the chat. Eve Rose is taking 3 classes and juggling a job, and Aaron is taking 5 classes and juggling a job. So I was asking them, how are you guys doing, juggling? I'm gonna turn it back up soon, pals. I see you, pals. How do you guys feel juggling school and work? Because I was having a conversation with one of my students the other day and I was telling them, you can do it, you just have to be disciplined. Eve Rose, you're a mom too? Eve Rose, kudos to you. You see, kudos to you. You could do it. Let me restart my song for you, just for you, Eve Rose. You got this. You really got this. I see you, Dr. Henry. As we all know, we're getting to 6K likes. Once we hit 6K likes, we're gonna go ahead and get started on a trending topic in healthcare. You guys, my guess, probably won't be available until maybe like around 7:30-ish, but they had told me that they are gonna try to come on a little bit earlier. Y'all know I get anxious very easy, so if you see around that time the guest is still not here, y'all just talk to me in the chat, please. I'm just being transparent, okay? I do have my agenda. I got all my stuff planned out, but if they don't show up accordingly, just, y'all know, hold me down in the chat. Dr. T, I see you. So we replaying the song. My friend in the chat, Eve Rose, she's a mom. She has a 1-year-old, just got hired as a CNA, and she's currently in school working on her bachelor's degree and currently taking 3 classes and juggling it all. Shout out to you, Eve Rose. I see you. Dr. Henry, every time you come into my chat, I always have to big you up. Dr. Henry, Dr. Henry, yes, I always got to big you up too, Dr. Henry. You were talking about a very important topic today. I kind of came in on the back end because I had just gotten home and I was doing some things and preparing for the live, so I couldn't catch the whole live. But Dr. Henry, you was talking about I almost cussed. You was talking about some good stuff in there, okay? Very important stuff. But Dr. T, I always have to big you up when you come into the chat. You're doing such great work. I big you up in private, but I'm big on bigging people up in public too. Continue to show up. You are growing your community. You are doing a great job, and I love to see you just connecting with so many different professionals on here who could further grow the health hub. So keep on doing what you're doing, okay? I see you guys connecting in the chat. Mandy, welcome on in. I see you. Let's play my song. Oh, if anybody knows Dr. T needs a theme song. I'm not putting pressure on nobody, but if you feel moved, and if you guys have already connected with her, and you guys have a rapport, Dr. T is looking for, would be so grateful for a theme song.
One of it, help that.
Let's turn my stuff up. Lady Red said, play my song. I'm playing it.
PSD body still so kind. Cultural roots in the work is done. Teaching us how care is one of it. Healthcare vision steady and strong.
Eve Rose, I do have a couple of family members who worked in hospice and they enjoyed it. They liked hospice and they also liked labor and delivery. So look into. Don't be nervous, Eve Rose.
Helping professionals move along. Find your place.
I see you, Dr. Henry. I appreciate you. Amara, welcome on in. I see you. Let me pull. Hold on, y'all moving fast. Let me pull up my thing. Shows you how to move with grace. Lead with wisdom. Own your space. It's office hours with Dr. J. Tuesday nights at 7. We're on the way. Okay, I'm just pulling my stuff up because y'all moving fast. Y'all moving fast. We have 5 kids. Damn, moving ready. From the classroom to the light, he makes the culture feel alive. Teaching truth with heart and vision. There's Dr. Johnson on a mission. We good. Hospice is a different sense if you open your mind to it. Yup. Yup. Dr. Henry, I see you. Lady Red, thank you. You see what you guys are doing in the chat? This is office hours. I love how you guys are connecting with each other. You guys are sharing your experiences. You guys are, dropping gems to each other. This is what I love my room to be about. This is why I do what I do. You guys are amazing. I see you guys. Lady Red, I see you dropping those gems. And Eve Rose, I see you receiving those gems. I appreciate you guys so much in the chat. Okay, let's play my song because we almost there. Community over cloud or trend. That's how leaders truly win. He don't just talk it, he models it. Every comment intention will deliberate the blueprint for what it means to build online communities. It's office hours with Dr. J. Tuesday nights at 7, we're on the way. Trending topics, breaking it down. Bringing real experts into town. From the classroom to the light, he makes the culture feel alive. Teaching truth with art and... Y'all, welcome to Office Hours with Dr. Johnson. I see you guys in the chat. Y'all got me there. Aaron, I see you liking the live. Coach Resilient, I see you. Welcome on in. El Meek, I see you. I see you. I see you. So, before we jump into it, my guests, said probably they won't be able to come until maybe like around 7:30-ish, but they're going to try to come on a little bit before. So if y'all, I'm just being transparent, being vulnerable. If you see that time come and my guest's not up here yet, just hold me down in the chat. Okay, please, just because y'all know I get anxious and nervous real easily. But you see one of my moderators pinned it, Pals, aka Chief of Staff. The trending topic in healthcare that I want to discuss with you, it probably won't be that brief. It probably will not be that brief. PD, I see you. Welcome on in. We're just getting into my trending topic in healthcare. Adriana, I see you. Welcome on in. So, like my moderator just pinned, new screening of cancer. And the topics that we're going to be discussing today, you guys, please, can I have some F1s in the chat? Miss Keena, I see you. Welcome on in. Can I have some F1s in the chat? Because we're going to be saying some key words that, you know who doesn't really like. Adriana in the chat saying real clean. Adriana, leave me. Adriana, please leave. You're gonna make me laugh. Please leave. We talking about cancer here. It's real big. So F1's in the chat as we start discussing about my trending topic in healthcare. Okay, we love the TikTok shop and we dropping F1s and we dropping fruits in the chats. Okay, let me back up for y'all. So there is a new blood test that screens for multiple types of cancer. As I am going through my topic, can you guys drop in the chat? Have you guys experienced cancer yourself, or do you guys know anybody who has had cancer or have gone through cancer or lost their battle to cancer? We are always transparent, no judgment here in the chat, but today's topic is cancer because it could affect anyone. It can affect anyone, okay? PD, I see you. Lady Red, I see you. Aaron, I see you. So there is a new blood test that screens for multiple types of cancers. You guys know I got my screen here. This is an article fresh off the grease. It was published yesterday, okay? Real news. Miss Keena, I see you. Something you could use, I see you. So the Food and Drug Administration has been evaluating a blood test called Gallery, just like how it's pronounced, Gallery. Okay, as a breakthrough device that can detect many different types of cancers in one test. Can I have 2 people drop the word gallery in the chat? 2 people dropped gallery in the word chat. I'm gonna slow it down today because you guys already told y'all what was going on. So the FDA could approve it later this year, clearing the way for such testing to become broadly available. Okay. Currently in the US, we always got to share some facts, okay? The FDA is still working. I see that question. The FDA is still working. Currently in the US, it's common to screen for 5 common cancers, okay? And those 5 common cancers are breast, colon, cervical, prostate, and lung. F1's in the chat. F1's in the chat. The 5 common cancers in the United States of America is breast, colon, cervical, prostate, and lung. Okay, each requiring its own type of test, like a CT scan or a pap smear. We all get the point. Can I continue with the F1s in the chat? I see you guys. Thank you so much. So by comparison, the Gallery test can detect small amounts of DNA or other cancer markers for up to 50 for up to 50 cancers in a single vial of blood. F1's in the chat. F1's in the chat. How many people, you or somebody you know, had cancer, found out too late, and we all know how that goes. With this test, the Gallery, it will be able to overall let me break it down. Just early detection. Early detection. I remember a couple sessions ago we had discussed pharmaceutical companies and how they are making money essentially off of these medications and off of just cancer patients and off of, you know, those who are experiencing HIV and AIDS. Y'all know they got the cure for AIDS. I see you, PD. They got the cure for cancer. You think that we will ever get it? Let's not get too conspiracy theory. I see you, PD. Thank you so much. Let's not get too conspiracy theory, but you know, like I always tell you guys, healthcare is a business. Healthcare is a business. Do you guys think they're going to allow this? Do you guys think they're going to push this out? Will we have this test called Gallery that will test for up to 50 different cancers in one single vial of blood? You guys, that single vial of blood literally could be this size. That single vial of blood. Okay? Miss Keena said, y'all seen Magic Johnson. Y'all seen Magic Johnson. He got the cure. He has the resources and the cure, and he's a spokesperson. Hello. Miss Keena, thank you for that example. I want to repeat. By comparison, the Gallery test can detect small amounts of DNA or other cancer markers for up to 50 cancers. You guys, this is big. Just one vial of blood can rule out if you have cancer in 50 different areas or 50 different types. Isn't this important? What are we thinking? What are we feeling? I want to hear you guys in the chat. Can we drop it in the chat? What are we feeling? The Gallery and another test called Cancer Guard by Exact Sciences are both multi-science and early detection tests that already can be ordered in the US under a special FDA designation. Okay, a more rigorous FDA approval process will be necessary for the test. There we go. You see, why is it rigorous? Why is it rigorous? Right. A more rigorous FDA approval process will be necessary for the test to be covered by Medicare and other insurances. You see what we're talking about? We just spoke about it. Healthcare is a business. Can I have just at least one person drop healthcare is a business in the chat? Exactly, Mandy. They're going to make it harder. Exactly, Dr. Henry. Our doctor in the chat said, I'm hopeful because I see too much cancer way too late. Exactly, Dr. PD. Dr. PD, I need you to add DR in front of the PD so folks know. Please, PD. Well, I mean, folks do know because I see there's an emoji. Dr. Henry, I see you. Healthcare is definitely a business. What does this mean going forward? You see, stage 4 cancer or those who are at the late stage of cancer, this will kind of diminish that. This will kind of bring it in and provide early detection for so many people, regardless of what insurance you have, or it's supposed to. Ellie Mac, I see you, welcome on in. Ruby, I see you, welcome on in. It's supposed to. I just saw the word scam in the chat, and I want to repeat again. Healthcare is a scam. Meskina, I see you on one today, and you speak in facts. It's important for us to be hopeful, yes, but they're already stating that it's going to be very rigorous. It is going to be very rigorous. Let's get back into this. So, catching more before stage 4, okay? Catching more before stage 4, a diagnosis will always require a follow-up exam, but tests offers solid guidance for doctors overall. Okay, so these healthcare professionals, they are pushing for this. All healthcare professionals would push for this, but will the insurance companies approve it? Will the prior authorization for those medical people in the chat, will the prior authorizations get approved? That's the issue here. So yes, we are grateful for these new tests. We are grateful that the FDA is expanding their research and doing their regulatory reviews to push this out to the public. But will it get approved? Will these prior authorizations get approved? Will these insurance companies give folks a hard time who's already having a hard time just by having the cancer? F1's in the chat. Everyone's in the chat. I don't know if cancer is a bad word. The chat is moving. Let me see what you guys are saying. Miss Crystal, I see you. Welcome on in. We are just discussing my trending topic in healthcare. It's a new screening for cancer. Today, we are just going to have to be dropping them F1s. No, especially not United. Oh, boy. Eve Rose said, especially not United. But you know what, you guys? Somebody ate my apple. We do have to stay hopeful. We do have to see, be optimistic. Definitely be optimistic, because there are some improvements overall. Okay? If you had somebody who had cancer, or you personally had cancer, was there anything that you would change or could have done differently throughout the journey? Because that when you have cancer, it is definitely a journey. Drop it in the chat, where whoever feels comfortable. What is the? Do you know somebody who had cancer, and thinking about their overall journey, what could have been done differently? Early detection, maybe a different route, maybe chemo, maybe radiation. What could have been done differently? For me, we would welcome early detection. We would welcome early detection, but it's not always available. Ooh. Ms. Keena said cannabis, okay? Oh, Crystal said another one, especially in the Black and brown communities. Wait, let me scroll back up. Not hiding that from the rest of us. Why? Crystal, you just woke something up. Why, when our older folks, find out they got cancer, they want to hide it? And they don't want to fight the good fight. We've been fighting all our lives as Black and brown folks. They've been fighting all our lives. So all of a sudden, right when they get struck with cancer, they not putting up no fight. Why do they do that? Why do they always want to hide the diagnosis, and then you find out, and when the person, your loved one, only got 3 to 6 weeks left to live? Ain't that messed up? And then you hooting and hollering towards it. You guys drop F1s in the chat, please. And somebody tell me, why do our folks do that? Our older folks too. Why are they so secretive when it comes to their medical exams or their diagnoses? Why are our folks so secretive? And don't let them be from the Caribbean. They so damn secretive. Auntie, what's going on? Mama, what the doctor said do you have? I'm coming in there with you to the room and listening to what the doctor has to say. Grandma, what the people told you? There's a saying that says our parents and our grandparents become our kids as they get older and as we get older. Ain't it true? Ain't it true? Why are our people so secretive? Oh, hold on. Let me scroll back down in the chat. It's going. Hold on. Let me see. Something you could use said, my dad was gone within 3 months. Early detection could have helped. I'm so sorry to hear that. Something you could use. Thank you for sharing that. Early detection could have definitely helped. They are tired of fighting. Some of them are definitely tired of fighting. And it's sad too. Miss Keena said, because they was told God don't make no mistakes. Lord have mercy. He don't make no mistakes, But faith without works is dead. So F1's in the chat. Faith without works is dead, but you got to put in the work too. You could pray. You could be a prayer warrior, but you got to put in the work. Please, we got to put in the work. So get that chemo, get that radiation. Let me see what else is going on in the chat. I see you guys. Hold on. Something you could use said stubborn. Is that what it is? PD said he said it's the truth. Dr. PD said he sees it weekly. The past shame for being sick. Yeah, the same thing with mental health. Everybody could have an issue with mental health. Any and anybody can get cancer. I don't. There should never be no shame. There should never be no shame. Ain't that something? Powell said it must be hard to talk about. They don't want pity. Or keep your hair and take herbs. Okay. Okay, and my guest is here. You see, God, ooh, God is so good. I see you guys in the chat. I appreciate you. We wrapping up our trending topic in healthcare. Before I bring my guest up, it was a blood test that screens for multiple types of cancers. It may be available soon, and it is with one vial of blood, it could test for different cancers. 50. Can I, before I bring my guest up, can I have just one person drop the word 50, the number 50 in the chat, please? 50. That's big. I'll keep y'all posted. You know what I need to start doing? I need the trending topics in healthcare. I need to start providing some follow-ups on my page because I see you. Not only am I invested, but you guys are invested too. I see you, Lady Red. I see you, Abby Noel. I see you, Crystal. I'm gonna start doing that, adding some follow-ups. Let's bring up my guests.
Good afternoon.
All right, Miss Habesha, can you see us? Can you hear it? Okay, we hold on. Damn you.
There you are.
Let me put in my thing. Okay, you guys, thumbs up in the chat. Is it
There.
on?
Oh, you just went away. Can you hear me fine?
Yes, I can see you. Thumbs up in the chat. Can you guys hear her fine? Before we continue, okay, we good. Pals, we good. Lady Red, we good. Perfect. Habesha, the therapist. Habesha, the therapist. I can't hear myself. Hold on. We still good with the audio? We still good with the audio? I couldn't hear. I gotta hear her today. I'm making sure I hear this one. We still good with the audio? Miss Habisha, let me tell you something before we get into your interview, okay? I just want to tell you, your quick tidbits of information and fast facts and just relatable information. Keep on doing it. It is, I follow you, we follow each other, but it is all done my FYP, and that's definitely for a reason. So continue dropping those gems, okay? And those gems is why you are here today. Those gems is how we got connected. So that before we get, I don't want to forget. Continue to drop those gems. It's amazing work. And guess what? You would never know what people need to hear from somebody else, you know? So without further ado, Miss Habisha, can you just briefly provide educational and professional background? Who is Habisha the therapist? This is social media, so whatever you don't feel comfortable sharing, we could use context clues, okay?
Well, first, I just want to say thank you for your kind introduction and just we're such supporters of each other. And that's one of the many things I'm grateful for social media is you just never know whose page you come across, what lives you impact, who's watching, who's listening. And so I appreciate for you, your support. I love what you do,
Thank you.
which
Thank
is
you.
why I don't always say yes to things these days with limited availability, but I couldn't say no to your invitation here because I am such a supporter of your work. You, with every live and consistency, we see you. We are so grateful for what you do, the information you provide.
I appreciate
So
you.
thank you. Thank you for having me. So my first name is Almaz and my last name is Nugusabland. And my license is LCSW. I was born in Eritrea, East Africa, and I moved to the United States when I was younger, just in middle school. And just like many immigrant families, mental health was not
Mm,
something that we openly discussed. I'm sure I've heard some of your lives, and that was something I'm sure you can relate to, Dr. Johnson. And often in my community and other communities of immigrants, we push through challenges and we are celebrated for being resilient, for taking challenges. And so my hope is to take some of that burden away by normalizing mental health, by providing education. I'm grateful to be here today and a little bit about my educational background. I obtained my psychology degree from here. I live here in California. I'm licensed here in California. So my undergraduate degree is from Sonoma State University, and my master's degree is from University of Pennsylvania in Philadelphia. And today I'm just working as a private practice owner here in California. I've been in practice for 16 years. I can't believe that's a whole teenage child. 16 years I've been in practice. You know, now that I'm doing my private practice, I would say I have a lot more flexibility. My current work focuses a lot on, right? Okay, UPenn. Do we have other UPenn grads here? And my work here in my practice focuses a lot on relationships, anxiety, depression, burnout, sleep issues. I specialize in sleep and helping people move beyond, just as I said earlier, immigrants, people of color, beyond kind of surviving, but truly work on healing, because healing is not a full stop, it's a dot, 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 right? And so we work on healing every day. Every day is a new opportunity to wake up and make a better choice to improve ourselves and to heal traumas. And so I'm feeling, thank you so much, extremely grateful. Thank you. Who is that? Grateful. Oh, thank you so much. That was so kind. And so, you know, beyond just that hustle and bustle, and really actually take in the superpower that's within us. And thank you so much. And also founded an organization that is called Habesha Health. It's been around, actually. I started it in 2013. So it's been 13 years of the work, which is educating East African, Eritrean, Ethiopian people, bringing, you know, experts from our communities with our language, by us, for us kind of thing. But the education is in English, so it's accessible to anyone who can understand English. And that is just, I truly believe culturally competent work is how we can heal each other and how we can bring in relevant, culturally relatable information and mental health information into all of our communities to make an impact. So I'm very grateful and proud of the work that we do there. It's volunteer ran for now until we get some funding, but for now it is, you know, it's wonderful to see communities come together just to heal one another. I'm very proud of the work that we do.
Amazing.
Here, TikTok is all about mental health for now.
Right. I love that.
Thank you.
Ms. Almaz, thank you so much for that introduction. You see, you guys, when I bring up my guests and they're going down their resume, like Miss Crystal said in the chat, it brings a smile to my face because I'm always like, yes, show these people why Dr. Johnson saw something in you and wanted to make sure he invited you for office hours. So, Ms. Almaz, thank you so much for you know, the work that you do, the important work that you do. Okay, I want to jump right into it. We did discuss that we're going to go over some mental health stigmas, but it's the first question: what are some of the most persistent stigmas surrounding mental health that you still encounter today?
Yeah, I think the stigmas are really just to even the word mental health. I think that when people hear mental health, they hear crazy, they hear unstable person, they hear things that are just not true, right? Mental health is just, I want us to see it like if your tooth is hurting, you wouldn't wait until it's rotten to see a dentist, right? Like if it's really, you won't wait until it starts to really start to fall out to brush it. You would actually have a daily routine to maintain your tooth health, dental health, hearing, eyes, all of that. The thing that I hear consistently is, oh, mental health is not for me. I'm fine. Or if people are in a relationship, he needs to go get fixed. She needs to go get fixed. And not really collectively, we could use a safe space to come together and talk about our challenges. And like I said in my resume, right? Like the mental health is not necessarily the stigmas that we hear. It's actually the way that we live our lives, the routines that we don't have. Maybe it's just like preventing fire from happening. That's really how I want us to hear mental health and see mental health is an opportunity to maintain our lives and not necessarily putting out fire. There are some unfortunate events when people do forget their mental health for too long that can lead to possibly, crisis moments, but there is definitely providers out there that are willing, creating safe space and bias, non-judgmental space for us to heal. So the primary, stigmas that I hear is mental health is for people who are terribly doing unwell. And that's not, as you know, true.
Right. Right. Thank you so
Yeah.
much for sharing that. And we're just going to continue jumping right into it. For those of you just joining the chat, welcome to Office Hours with Dr. Johnson. Today we are interviewing Miss Almaz, okay? The therapist, okay? Subject matter expert, okay? Can I have two people drop my subject matter expert stickers in the chat? Before we continue, as you guys know, a thumbs up or praying hands is me just acknowledging you guys in the chat. I don't want to interrupt our guests, but a thumbs up or praying hands is me acknowledging you guys in the chat. So, Miss Almas, if you see me doing this, I'm not trying to rush you. I'm talking to my people, okay?
Good.
So I want to
No,
continue. Perfect. I want to continue. So you mentioned cultural competency and the importance of cultural competency. And for my dissertation, I did cultural competency for healthcare professionals and the importance of that. And I created a course syllabus that was geared for nursing students and for healthcare administration students. And then for my research thesis, I did what are some strategies to implement into healthcare facilities to alleviate nurses' burnout and maintain positive levels of emotional intelligence. So from my bachelor's degree to my doctorate degree, my foundational research has always been how to improve the healthcare professional in order to continue providing quality care overall. And like you said, the part of the roots, cultural competency. It's important because diverse populations will never go away. As our society evolves, diversity evolves as well. There will always be a diverse patient population. Okay. With that being said, Ms. Almas, how do cultural, racial, and socioeconomic factors influence mental health stigmas from your personal experience? As you know, there's no right or wrong answer. You're here because you're a subject matter expert, and we want your perspective. We want your experience, okay?
So your question is, how do these factors impact mental health care or mental health perspective, or
mental health perspective or care, whichever route you want to take.
Yeah. I think that cultural perspectives, especially in like a working spaces, I think there are a lot of misconceptions and misunderstandings about what a culture is perceived and seen.
Right.
And there's a big gap, and I'm very grateful for the work that you did, and I look forward to learning more about it. I think that the lack of understanding is such a harmful thing for our society. When there's an absence of understanding someone's culture, I think there is a missed opportunity to really connect. If you're an employer, to connect with your employee. I think that when we don't understand someone's culture or where they're coming from, we fill in the blank for them. And in social work school too, that is one of the main things we learn is really not to assume, but to ask, to really ask someone's culture and what that means to them. Even me being from Eritrea, East Africa, you can't assume me and my neighbor practice the same culture. Right. Each person could have a different approach to their culture. To you, I believe you're Jamaican, correct?
Yes.
Yeah. So how you practice your Jamaican culture could be different. So it's important for me to be very curious about how you relate to your culture in order for me to connect with you and understand how you are approaching an issue at work or how you are approaching an issue in your relationship. And so as a therapist, we have to wear the hat of a curiosity and questioning and asking and not necessarily assuming, I knew a Jamaican one day and this is how they must behave, or they like this food, or they really just understanding you as a Jamaican. How does that relate? How do you relate to your culture, and how does that show up in your everyday life? And really asking questions that directly apply to you as a person. So just curiosity, it invites us to be more curious and ask questions. And I think societally, like there is a lot of, when we look at from government down, there's a lot of assumptions, especially during like COVID, what was being said and done to like people from a different culture, right? Like not really understanding, just making assumptions. There's like a countrywide assumption about people from a certain part of the world brought the disease here. And so really just a general hate towards that group. And that caused a lot of harm, a lot of fear. There are still people that I work with that are still
Mm-hmm.
healing from those harms that were done
Mm-hmm.
by as a country, right? That what we did to them. And so I do think that that is there's a huge kind of benefit from having a collective understanding of people's culture
Mm-hmm.
and inviting curiosity about people's culture.
Inviting curiosity. I love that, Miss Almaz.
Yeah.
Thank you so much for sharing that. Um, I want you mentioned fears, okay? What advice would you give to someone who fears being judged for seeking therapy?
Mm,
Let
that's such
let
a great
yeah,
question. Yeah.
yeah. Let's wait
Yeah.
from a therapist, from your
Yeah.
perspective. What advice would you give to someone who fears being judged for seeking therapy?
My therapist hat is always, as I just said, investigating. If it was someone sitting in front of me, I would really want to get, deeper into why that fear is there. Fear is such a big crippling word that it's like a jacket. Someone gave it to you. You wear the jacket and you wear it in the middle of the summer, even
Mhm.
though it's not cold outside. So it can get in the way of you getting into a healing space. It's really like a wall that you created, whether it's you, a generational kind of stories that were told to you about what therapy is.
Right.
Somehow, if this person was in front of me, somehow that was story was told to you that
Mm-hmm.
therapy is an unsafe
Mm-hmm.
thing to for you, and I would, after unpacking that, I would kind of then start to provide psychoeducation about the misconceptions of what therapy is not, and just asking that person what they meeting them exactly where they are and not really where I want them to be, and helping them understand that therapy can also be a place they can heal, and that could be a good place to start. Is the fear could be a good place to really unpack what that fear means to them, helping them to really find awareness of themselves, of their thoughts, of their fears, and just improving their relationship with the actual word therapy, and really creating a goal around or other issues that they're coming to therapy with. But it's a huge issue,
Mm-hmm.
especially if you're working in spaces that are court mandated spaces. People are really coming to seeing therapy as a punishment and not really a space to improve themselves.
Right. Right. Can I have two people just my subject matter expert stickers in the chat, please? Now, Miss Alma, you know I do my homework. So I also did my research and found out that you're also certified in behavioral trauma therapy. Okay, so I want to briefly tap into that. Okay. What are some signs that unresolved trauma may be affecting someone's daily life? What would you think from your experience within trauma therapy? What are some signs that unresolved trauma may be affecting someone's everyday life?
Yeah, I think that the people in your life can be your mirror for you
Mm,
as to how unresolved trauma is showing up for you,
mhm,
or the people around you. Are you kind of having challenges keeping relationships? Are there patterns that people are noticing
right.
about you that maybe you can't see, but you're hearing the same thing from different people?
Mhm,
And are there any blockages in your life that you can be honest with yourself and understand that is where you are? Maybe you can benefit. Are you hypervigilant? Right. The jacket example I gave earlier, but I'll also give another hypervigilance example. Is, let's say this is a flashlight. This is a
mhm,
flashlight, and you
mhm,
need a flashlight in the dark, and you are using it to get around.
right.
But let's say it's right now. I'm in California. It's 4:46 p.m.
Mhm,
And I'm going to turn on the flashlight and go through this sunny day. Like
mhm,
really looking, and that is how trauma shows up: as your hypervigilance, protective of yourself when you're not facing any harm.
right.
You really are in space of, you can't hurt me, even though the person in front of you is really not have any intention of hurting you. So this assumption, like how a person who is maybe a parent who is abusive to you, you get in a relationship and you might be thinking this person is it really just misunderstanding their intention and assuming that they're going to hurt me too, the same way that my caregiver hurt me, my teacher hurt me, my pastor hurt me. Really carrying that, yes, perceived threat versus actual threat. Exactly. And so therapy can help you kind of differentiate what's what. And that is really what it is what your perceived threat is getting in the way. Thank you, Crystal. That's a great point. Yeah.
Thank you so much for answering that and providing that example. Do you guys? I just want to continue saying. Do you guys see why she's here? Y'all see why she's here? Let's continue, okay?
You're so kind.
Miss Almaz, what role does resilience and protective factors play in recovery? Okay, because people are always saying, I'm on my healing journey. I'm in recovery. Okay, we hear that oftentimes in various conversations. What role do resilience and protective factors play in recovery? Would you say?
Let me write that question. What role does
resilience and protective factors play in recovery? What would you say?
I think that in recovery, so resilience is something that is and my brain always goes to immigrants and the way that we think, and
Let's take it there.
we are such resilient people. And resiliency can create, and it's a beautiful thing to have,
Right.
but you don't always have to be resilient. You can actually be vulnerable. And I know both can be true at the same time, but I do think that resiliency is not kind of absence of hardship. I think it's ability to adapt. Like immigrants come to this country and they adapt to new language, new, experiences, and or even our Black Americans, brothers and sisters, come to this country, create a new life from scratch, create a life for us immigrants. Like we wouldn't be here without them.
Right.
And really, and I think that's a whole different topic. But I think, it is the resilience that exists between us and people who look like us. And resilience is often confused with if you're resilient, you can't be vulnerable. If you're resilient, you cannot be, you can't cry. Like especially raising. I have two sons. They are ages 7 and 5. So it's important for me to really emphasize the importance of crying. It's okay to cry. I'm not going to interrupt you if you're crying just because you're a boy.
Okay.
Because I don't want you to be somebody's partner in the future and have to, take that into your life. And so we have to break generational cycles of toxic kind of thinking about how men should be. I'm raising somebody's husband. I'm raising somebody's director. I'm raising somebody's physician, lawyer. I'm not raising somebody who lives in a scarcity kind of mindset. And so protective factors are things I think that can help us against, like I see a tire. If you have a good tire, you're likely, or if you have a good shoes with grip on it, you're likely to catch yourself before you fall. And so protective factors are, like flossing every day will prevent you having cavities, right? And so I see that in the same kind of way. Yes, generational cycles of toxicity. Yes, absolutely. You got to break them.
Right. Ms. Almond, you know what I love about your teachings? I love how you can consistently provide examples. I do the same in my classroom, when I'm teaching different subjects. It's important that you could connect real world examples or experiences to the topic that we are discussing overall. So thank you so much for, being a subject matter expert and able to align the real world, real life with the topic at hand. I want to briefly tap into social work and mental health, okay? And disparities, okay? What are some of the biggest disparities that you see in access to mental health services overall?
The biggest disparities that for people to access. So let's just start with, we're talking about people ability to access, but let's start with where we are right now as a country. And if you notice, there was recent changes on what's considered professional. And, social work was on there, a lot of important kind of work that helps to impact people, makes it affordable, right? Social worker might be a little bit more affordable than a psychologist, right? And it doesn't mean it's always consistent. Sometimes a social worker may charge more, but just generally speaking,
Right.
a lot of women, especially as Black women, it wasn't originally a Black woman field, right? And we come into this field and we are wanting to serve our people, but there has been some pushback higher up to, discourage us to think ourselves as professionals. Now, is that going to change us serving our people and doing what we do, what we love to do? No, it's not going to change. But the messaging, I'm only imagining people when they're in their early 20s and how literal they take what they see on the news. These are all very temporary things. This administration will come and then will go, and we hopefully get a better administration. But when you hear these kinds of messages around what's considered professional, what's not, there might be some people who literally take what they see and actually be discouraged from going to social works. And automatically, we lost thousands of people who could have gone to social work schools. And, let's say thousands of Black people who could have gone and were discouraged. Well, I'm trying to go if it's not, if it's not going to be considered professional or get a loan for it. That's essentially the issue is not having a loan to pay for it. And that affects access to mental health eventually, right? Like that bigger decisions that are being made, even if it's temporary, we lose out on so many people that could have been great in our field. We need more of you like me and you, like, Dr. Lewis and Dr. Tanya, all these people that are in the chat, I'm assuming are in our field in their own rights. We need more of us because there's more of us that need help in the real world. And so, unfortunately, when systems like that exist, it really becomes challenging to inspire the next generation of social workers and therapists to join our forces and help us heal our communities. And so while it's temporary, it still is impactful negatively. And therefore, it impacts the consumer, right? It impacts people that are in the receiving end of mental health.
Right. Okay. I hear you, Miss Almaz. I hear you. I want to briefly touch on a topic that is important to the both of us, okay? Which is representation. Okay. Why is representation important within mental health overall? I just want your raw, honest, transparent answer. I'll repeat the question one more time. Why is representation important within the mental health space overall?
Great question. So I am contracted with a hospital system here, and it's important to me that because there is maybe me and then maybe one other Black therapist within the system, that it is important for me that I tell them my preference. Now, do I have, all spectrum of clients? Yes. But if I can help it coming from that insurance, I want you to send me more Black people, right? I want to be able to support, and I know that that's what they're looking for because I get emails almost every day about that. And so it's important to people to be seen by people who look like them. And there may be some, non-mental health related, you may have some, I don't know, heart issues that you have the best, doctor from China that you want to see. Great, go for it. But I do think that cultural competence and cultural connection is very important for your healing. You don't want to go to a therapist who, you have to really start from scratch to explain what things could mean. Of course, there still needs to be, like I said earlier, the curiosity has to be there. But I do think that is a very key part of the connection and the healing. And because, you don't want, if I'm like doing something that's related to my culture, I wouldn't want my therapist to assume something else that's not. I would want some understanding.
Right. Like Miss Crystal said in the chat, we want to see people who will get us. Exactly.
Yeah. I mean, there's many, many cases that have been studied around child therapists assuming there's abuse happening when it's really just something completely unrelated to abuse because the therapist is assuming. There's also that, the bias, right? The bias I have my bias, we all have our biases. You just can't shy away from understanding your biases. You can't say just because I'm a woman of color, I don't have biases. The difference is me being a woman of color with biases. I can't assume that I know it all just because I'm a Black woman, right? Like I have to say, I am a Black woman who have lived through some discrimination in my work or my personal life, but I also have my biases and I need to check them and I need to understand them before I go, heal other people.
Right.
I can only meet people as far as I've met myself. And so it's really important to have that connection and understanding.
Exactly. Speaking of biases, I want to tap into something really quickly from your perspective. Would
Yes,
you
ma'am.
would you say would you say a client or a patient's cultural background can influence their overall therapeutic approach?
Wait, say that again. Do
Would
I?
you do you believe that a patient or a client's cultural background can influence their overall therapeutic approach, the way they receive care or their treatment?
Mhm.
Would you say that affects their treatment plan overall?
Generally speaking, yeah, I mean, it depends on what culture we're talking about, where,
Mhm.
but I do think that person's upbringing really shapes the way they see the world, right? It really, it has its own kind of, it's like a scale, right? If you
Right.
were growing up in a certain cultural household and you were not allowed to have friends outside of that culture for many,
Mhm.
many years, you are going to have, your own kind of perspectives. And so you as a consumer are coming into therapy with your own beliefs of, world. You have, that's why the work has to get done. The work is important for each and every one of us, is to really do the work on yourself in order to understand, why do I think the way that I think? Why do I get triggered by this? Oh, it's because of my mom. Oh,
Right.
it's because of my family believed in this way, and really just understanding what were my family values and why am I kind of so still connected to that. I mean,
Mhm.
you're a human being. You can't, it's not like a unplug.
Mhm.
You can't unplug it if you want to still stay in touch with your family. And a lot of the families haven't done any work. And
Mhm.
so you're going to Thanksgiving with people who don't even like the word therapy, but you've been in therapy for 5 years. You know what I mean? So it's hard. It is work. The work is being able to do the work for 5 years and still go to Thanksgiving and still enjoy finding your peace and who do I flow better with and not really expecting everyone to be in the same that's right same flow as you.
Right. Right. I love that. Thank you so much for sharing that. Before
Of
we wrap up,
course.
I want to touch on maintenance. Okay, mental health maintenance is important. Okay,
Hmm.
your perspective, no right or wrong answer, but what are some daily habits that can contribute to long term mental wellness? What would you say from the therapist, from Habisha the therapist? What would be the recommendations for long term mental wellness?
um, the way you floss your teeth,
Mhm.
remember your mental health. Go for a walk, go for a run.
Mhm.
um, you maintain your, like, let's say you maintain your, I don't know, your weight by going to the gym.
Mhm.
You journal to maintain your mental health, right? Like having knowing the relationships that drain you from the relationships that feed you.
Right.
Paying attention to your, of course, I'm always going to encourage sleep. Like,
Right.
please, if there's anything y'all want to take away today from this conversation, is maintaining your mental health by getting enough sleep, right?
Mhm.
I'm not your mom, so I'm not trying to tell you what time to go to
Mhm.
bed, but I
Mhm.
do need us to be in better kind of alignment with our sleep, with our kind of the way we move our body, with our eating healthy, and yes, plug in our phone, keep it charging. Yes, same thing. I love that. That is such a great, Crystal. You're on fire. Has she been up here?
She's been
She
up
needs to
here.
be up here. Okay, good.
She's been up here. Yeah, I have to reach out to
She's
her for
on
something.
fire.
Yeah, I got to reach out to her for
Yeah,
something in the future too. But she's been up here.
love it.
I love it. I love it.
If you work from home, I would love to know that people are out to get, some sunlight,
Right.
getting some energy out from the sun. If, what we talked about earlier, it's really just knowing yourself and knowing your triggers. And if you're easily triggered in your relationship, really understanding, what is this representing? What about my relationship with my family does this connect back to? And really just having that constant. So when I work with someone for, let's say, a year
Hmm.
and I'm discharging them, I'm giving them my recommendations when we leave, right? Like one of the main things that I want to drive home when people leave is really, please, this time that we met, if it was Mondays at 12 p.m., I want you to continue to meet with yourself on Mondays at 12 p.m. Consistently journal, consistently. If I was still meeting with you, what, you know what I mean? Like, what would you want to tell me with your, with your week? Continue to check in with yourself, because unchecked self is like, if you don't check in with yourself, and sometimes I'll tell people, always go with a green highlighter and a red highlighter in your journal. If that week was like a green week, highlight it, go back to your red weeks again, read them again. What do we need to change about that week, right? And so it's really constantly checking with yourself, capturing your thoughts, and being able to be in alignment with yourself. Self-care doesn't have to be going to India for kind of a yoga retreat. Self-care could be when you are brushing your teeth, taking that deep breath. When you're sitting on the toilet, stretching your back, right? When you're walking, try not to walk like this. I want you to push your chest like you're supposed to be here. Right. I think that especially women and people of color in general, we are praised for, right, putting our head down, and we are celebrated for taking less space. And so take up as much space as you need, and come in with the power that you have, that your ancestors created for you. Right. And walk into a room like you're supposed to be here. Right. And I can go on and on and on about maintenance. I think that there's so many ways to look at it. And
right. I love that. Ms. Almaz, thank you so much. Before we wrap up with my two last questions, I do come across a lot of students, okay? And I do have some students here who are studying social work or within the mental health space overall. But from your acquired professional skills and knowledge, what advice would you give current students who are studying either social work or studying to work within the mental health space, psychiatry, or some type of counseling? What advice would you give them from your professional experience?
earlier I mentioned that the question is for people who are going to mental health field.
Mental health, social work, correct.
Yeah. I mean, as I said earlier, you meet your clients as far as you've met yourself. And so if you've met yourself at the very kind of surface level of mental health, is great, but not really you have to dig deeper on your own traumas. We all, unfortunately, have had traumas, but really understanding what is my trauma and how does it show up in myself, so it doesn't go into that therapy room with me, and so really understanding your personal work is important for your clients. Your personal work is, you cannot take from your client or take your clients any further than here. If this is all that you are, you want to get deeper with your clients. Second is being very curious. As I mentioned earlier, every client is from, whether it's culturally or their health or their mental health, they know themselves very well. Some people just need a mirror. Some people just need someone to sit and listen to them and reflect back to them what you're hearing, and that is really what it's supposed to be. And help them put the pieces back together, because every client comes with every piece that is part of their story. Right. They're just a little bit out of order. Sometimes they're a little bit disorganized, and our job as therapists is, let's lay them out on the table. This piece, where do you think it belongs? And really the puzzle gets connected to with the help of you sitting there with them.
I love that.
And another thing is, what we're doing right now is we met here and we came here to share our expertise. And it's important for therapists, future therapists, to maintain relationships and show up in spaces like conferences and walk away with a contact or with a card. And really being able to understand that when you walk in, is there a person? Maybe do some research on who the speakers are and how do I walk out from this with a relationship, and continue your research on what this field you're walking into means to you and to your community, and how do you want to show up? What is a missing or what is a need that you want to solve? Finally, take care of yourself. Get your sleep, get your sleep, get your sleep. Burnout is a real issue in our field, especially when often getting a lot of referrals, right? Trying to figure out, who do I want to take with me? And who do I want to help? You cannot help everybody. You cannot help everyone that walks into your door. And sometimes you have to make a tough decision of letting go of some clients who you can't help. Whether, not all money is good money, right? Whether it's because you don't have the expertise to help them, whether it's just not a good alignment. It's not just that the clients have to find you helpful, you also have to find the work helpful.
Right.
And so finding the confidence within you to say, this is a good, working relationship, this is not. And helping them, thank you so much. Helping them find appropriate referral that is good for them to make the changes that they want to see.
Right. I love that. Thank you so much for that breakdown. Last two questions, Miss Alma. We are here talking about mental health and maintenance and etc. What does Habesha the therapist do to stay on top of her mental health? What you got going on?
Ooh, great question. First, I drank my water all the time.
Okay.
And I try to find, intention in my day. I wake up and I kind of want predictability in my day. That is a form of self-care and self-love for me. I don't want to wake. I'm not typing in that way where I have everything lined out. But if there are tasks that I want to do, I want to wake up and I want to be very intentional about them. I'm trying to be classy, for Dr. Johnson's room here, and really having some kind of movement for the day. And I wish I could be honest with you. I wish I could say that I move my body every single day in the way that I want to. That's not always possible when you have two small kids.
Right.
And I garden. Gardening is a big part of my work. Like right now I'm growing string beans, tomatoes, cucumber, like like green onions. I like to cook. That's a big kind of, I love music. So listening to music and showing up in spaces with a kind of a lighter, supportive mindset helps me.
Right.
I'm sure there's so many I'm missing, but it is important for me to be consistent with myself and also model for my kids. I was just telling my husband, when I decided to become a parent, like I knew that I didn't want to parent from scarcity mindset. I didn't want to parent from neglecting myself mindset, right? It was important for me, whether I had a daughter or a son, to show my kids that I'm gonna choose me so that you can choose you, right? Like I don't want to raise you to feel like you need to be feeling guilty when you go out to take care of yourself or when you have a little treat or when like I will choose me so that I can model that for you.
Right.
And I would like to be consistent with that.
Right.
And that is very important to me.
Right. I love it. Thank you so much for being transparent. Ms. Almas, last question. I ask all of my guests this question, but what, Habesha the therapist, what is her overall why as it relates to the work that you do and the reason why you show up? What is your overall why?
Why the work that I do? I like to think that you were on the live yesterday with my good friend Elijah Frazier here, and I call him my health friend. Like now you're my health friend, you know what I mean? And so trying to apply health in my friendships and apply health in my connections and healing, right? I don't want to ever claim that I heal my clients. I help them to the healing journey begins, right? Or resumes if they've done it before. And so for me, it's such an honor and privilege to be part of people's healing journey. It is not ever to be taken lightly when someone trusts you with their story, their generational hurt or generational wishes and dreams. And it is such an honor to sit next to someone, even though it's virtually. You trusted me with the story that you may be feeling embarrassed to tell your partner. It's such a, I never ever want to forget this feeling that some of my clients, they check their admission to an MBA program with me because they're so nervous to open it with anyone else. Or what if I don't get in? They're going to judge me. I'm like, let's open it together. We can do this together. And so those are such tender moments that I want to never forget about my clients. And it's something that, there's people always say there's your mom, there's God, and then there's your therapist. These are the three people who don't judge you, you know? So I'm like, it's a privilege to be up there with those two other important, yeah. So
You're why. I love that. Well, Miss
that is my why. Thank you, Crystal.
Habesha, thank you so much for the work that you do. Thank you so much for, like I said, dropping the gems. Continue to show up and continue to be great. I appreciate the time for stepping into office hours with Dr. Johnson. This was great. I told you you would be in good hands. You did a great job. Okay, and the chat, they loved you, and I definitely would love for you to connect with Miss Crystal.
Thank you.
I would love for you
Yeah,
to
please.
I would love for
Let's
you to
follow each other.
connect with Dr. T, connect with
Yeah.
Dr. TD, and also Dr. Kirsten. She's also a licensed clinical social worker as well too. So, like I said, my office hours is definitely collaboration. Interdisciplinary collaboration is key. And I love how you are just so open. And once I heard you discuss cultural competency, I said, bingo, I got to bring her on. So thank you so much for the work that you do. Where can they follow you? Do you have a live schedule? What does Habesha the therapist got going on for her TikTok page?
Yeah, I would love. I used to do lives in
Mhm.
24, early 25.
Mhm.
I haven't done them, but this is warming me like up for going back, in these streets of TikTok. I would love to go back to doing lives. I think that it's such. I'll follow you back, Kristen. It's such an impactful space. TikTok, you can use it for good, you can use it for bad. It makes me feel so good to know that there are people like us that are using this space for such an intentional purpose.
Right.
And I feel very honored to exchange contact or just follow each other. And I'd love to go back on lives more.
Yeah.
Some projects that are more of a long term, but for right now, just kind of staying in touch on here. And I'm also trying to be active on Instagram and being more just engaging here. That's my goal.
I love that thing. Well, once again, Habesha, thank you so much for stepping into office hours with Dr. Johnson. I will drop you down. Before I drop her down, can I have some round of applause in the chat, please? Can I have some
Thank
round
you
of applause in the
all.
chat for
Thank
Miss
you, thank you,
Almaz
thank
in the
you.
chat?
Thank you, Crystal.
I see
Very
the
such an
heart.
honor.
Let me go ahead and drop you down, Miss Almaz. We'll be in
Thank you.
touch, okay?
Thank you for having me. Absolutely. Have a good one. Bye bye.
Okay, now subject matter expert. Okay, subject matter expert. We got the subject matter expert. So now we're going to transition over. We're going to wrap it up soon. You see, after I'm done with my guests, the stomach get to growling, I get to being hungry, and I just want to breeze through this. But we have to wrap it up. Okay, I see you. Thank you so much for the hats. I see you guys. I appreciate you, Dr. T. I see you, Miss Crystal. I see you, Miss Kirsten. I see you. So we are going to wrap up. We're going to do segment 3, which is Professor Tips. My moderator is over here. Okay. I see you, Aaron. Dr. J is hungry. Professor tip number 1, which one we doing? So as you all know, we do a trending topic in healthcare. Then we do an interviewed guest with a subject matter expert. And then look, Miss Crystal already talked about what's the jobs. I got the 3 jobs for you. My professor tip segment 3 is Professor Tips. I always share 3 different roles, okay, that is currently hiring. Now, the 3 roles that I share with you guys, if one is not for you, check out the company. Maybe they got something for you. Okay, one of my moderators pinned it. The first one is Well Sense Health Plan. Okay, Well Sense Health Plan. See, I'm already studying this because I'm hungry. They are currently looking for an operations manager within their care management department. Okay, you'll be reporting to the manager of care operations, responsible for documentation of care management processes and for providing operational oversight and analysis of our care management programs, including compliance, program development, evaluation, and performance monitoring. This role assumes management of accountability for the day-to-day non-clinical operations for programs and subject matter expert for program operations. This is full-time remote work. All of my 3 jobs that I always share is full-time work, okay? The salary is listed for this one. It is starting at $86,500 to $125,500. Y'all better apply to this job and negotiate in the middle somewhere at least. Okay, once again, Well Sense Health Plan. They are looking for an operations manager within their care management programs department. The salary ranges from $86,500 to $125,500. Well Sense Health Plan. Let's get into Professor Tip number 2. Professor Tip number 2. Which one we doing, Mod? Professor Tip number 2. Because I got them. Okay, we doing Lyra Health. So Lyra Health is looking for a training operations associates. a training operations associate. This role is looking for an operations associate to join the provider enablement team to help us grow and scale the core operations of our therapy programs. This role is a great fit if you are energized by working closely with therapists to enable their success, have a passion for creating frictionless clinical onboarding experiences, possess demonstrated project management skills, and have an eye towards scale. Fully remote, once again. The salary is listed for this one. This one is $68,000 to $103,000. Okay, apply to these jobs and negotiate. Ooh. Crystal, why you did that? I didn't even know that. Crystal, I'm gonna apply to the job and go work with you. We gonna have a ball. Crystal, I'm gonna apply to the. I'm gonna look for a job and I'm working. Okay, Crystal, why you should have never ever said that? Okay, look, my moderator want me to wrap it up, so we gonna wrap it up. Professor tip number 3 is NMDP. Okay, this is more so for I wouldn't say entry level, but if you don't have that much experience, this is a great way. You guys know I'm always going to provide a variety in the type of roles that I share. So NMDP, hold on, let me show you guys the what that acronym is. Let me pull it up. So National Marrow Donor Program, okay? National Marrow Donor Program, NMDP. You see my moderator got it. They are looking for hold on, let me pull it back up. A donor engagement specialist, fully remote. Okay, this could be geared for my students or who are currently in school studying healthcare administration, or Dr. PD, I see you, thank you so much. Or you are about to graduate and you're looking for some healthcare experience. This could be a great one. So NMDP is looking for a donor engagement specialist, fully remote. This position requires the ability to have a compelling conversation and to provide high quality customer service for donors within our registry who are being asked to save a patient's life. This role involves using investigative skills and partnerships with information from within the NMDP systems to locate and contact donors. It's a fully remote job, and this salary is from $26 an hour to $33 an hour. I got something for everybody. Whether you are a seasoned healthcare professional or you just want to start out, apply to this donor engagement specialist role. Negotiate your salary somewhere in between the 26 to 33. Don't start off that job at $26 an hour. Come on, my student, don't start that job off at 26. At least start off at, tell them folks 30, at least. Before we wrap it up, I share with you guys WellSense Operations Manager within their care management program. I share with you guys Lyra Health. They're looking for a fully remote training operations associate. And I just shared with you guys NMDP. They're looking for a donor engagement specialist. That's more so for entry level or mid entry level role within healthcare. Y'all, I gotta go. Yes, Miss Crystal said negotiate. We better negotiate these roles. We wrapping it up. This was a great live. I appreciate you. I see you, Dr. PD. I see you, Miss Crystal. I see you, Miss Kirsten. I see you, El Meek. I see you, Mr. Aaron. I see you. Something you could use. You guys are amazing. We wrapping it up. Can I have a couple deuces in the chat? Go rest and go eat. Miss Keena, you know the drill. Go rest and go eat. Miss Sharita, you never late. You here, and that's all that matters. I don't care what time you show up. Just as long as you show up, you here. Miss Sharita, you always good. Eve Rose, if you need me to email you the exact, you know what to do, Eve Rose. Hop in my messages. I will send you the exact link. Okay, Miss Keena. See, there's the deuces. So you guys, those who are still here, June is also Men's Mental Health Awareness Month. I am closing it out with Miss Sharita in the chat, aka Her Divine Alchemy. We're going to be wrapping up Men's Mental Health Awareness. And we're going to be discussing some important topics, okay? From a black man, from a black woman. I got you guys. You're going to be hearing from the both of us. Miss Kirsten, thank you so much for stopping by. I'm so glad you're able to make my office hours and see what I got going on, because Kirsten, we were connected and I just pulled you up on one of my conferences. But normally I like to bring my guests on, interview them in my office hours, and then later on invite them to a conference. But sometimes it don't gotta, we don't have to be that consistent. But thank you so much for showing up. Miss Tanya, I see you, Miss Tanya. Thank you so much. Miss Sharita, I see you. Miss Kina, I'm about to go eat. We're about to wrap it up. Deuces, yeah. I don't know. Maybe I'll come back on Thursday, depending on what I got going on. Miss Luna, I see you. Thank you so much for being here. We wrapping it up. We wrapping it up. I gotta go. I have to go eat. I'm hungry. It was a long day. This was good. This was good. I love what I do. I gotta go, y'all. Nope, Miss Luna, you showed up. You said hi to me real quick. You good. I appreciate you. Miss Sharita, you good. I appreciate you. Okay, gotta go for real.